So I went to see the doctor and all he did was suck my blood. I do not recommend Dr. 𝐂𝐎𝐿𝐒. Okay, let's say you're in the emergency room with a serious medical concern. Your doctor will likely order some blood tests to try to figure out what's going on. What exactly is he or she looking for? Well, there's the complete blood count, also known as the CBC. This looks at different cell types in your blood, including the white blood cell count. If this is elevated, it can indicate a serious infection. Then there's hemoglobin. This is a measurement of the red blood cells. These are the oxygen-carrying cells in the body. Of particular concern would be a low hemoglobin level. We call this anemia. In the worst case scenario, this could indicate bleeding. The thing to keep in mind here is that not all bleeding is obvious. It's not all gunshot wound to the chest with blood spurting out. Sometimes bleeding can be internal and may not be clearly visible, but the hemoglobin level will be low. In this way, the complete blood count, the CBC, can be very revealing. Then there's the platelet count. This has to do with blood clotting. I like to think of platelets as the bricks that form the blood clot. So a low platelet count can indicate an increased risk for bleeding. Moving on, there's the electrolyte panel. This includes sodium, potassium, chloride, bicarbonate. Examining these can help with making a vast array of diagnoses, including dehydration, where your sodium level may be elevated. Abnormal heart rhythms, otherwise known as arrhythmias, can be affected by abnormal electrolytes, in particular the potassium level. Low bicarbonate can suggest increased acid level in the blood. An example of this would be diabetic ketoacidosis, also known as DKA. This is the most feared complication of diabetes. Then there's the kidney function tests. These include BUN and creatinine. The kidneys are responsible for clearing these from the blood, so an elevated BUN and creatinine indicates that the kidneys are not doing their job effectively. We call this renal insufficiency. Oh, we're not done yet. Far from it. There's also liver function tests. These include AST and ALT. Elevations in these can suggest hepatitis. There's also bilirubin and alkaline phosphatase. These are other liver tests. Elevations in these might indicate gallbladder or a bile duct problem. And let's not forget about PT, PTT, and INR. These are measurements of clotting ability. Remember earlier I mentioned that the platelets were like the bricks of a blood clot? Well, the PT, PTT, and INR are measurements of the clotting factors, which I liken to the cement holding the blood clot together. So now we've talked about blood counts, electrolytes, kidney, and liver function. Let's move on to other organs, the heart. To evaluate for a heart attack, we obtain the troponin level. Troponin is a protein that's found in the heart, not the blood. If you see troponin in the blood, you can think of this as little pieces of the heart falling off into the bloodstream when the heart is under stress. The worst case scenario would be a heart attack. BNP, or brain natriuretic peptide, is another test that's commonly ordered to evaluate the heart, in particular congestive heart failure. Elevated BNP means that the body is trying, albeit unsuccessfully, to get rid of excess fluid. This is the case when the heart is not pumping properly. You get buildup of fluid in the body. And we're not done yet. There's still infectious studies. You can check the blood for bacterial infection. We do this with blood cultures, as well as looking for viruses like hepatitis or HIV. Then there's still more tests that can be ordered. Tests of the glands, like the thyroid gland. You can test TSH, thyroid stimulating hormone, or the adrenal glands. You can also test for rheumatologic conditions. And the list goes on and on. Whew, that's all I got for this video. That's a quick introduction into common blood tests that are ordered in the hospital setting. If you like seeing videos like this, medical content or healthcare related content, feel free to hit the subscribe button there or check out another video here. And I will see you guys next time.